Hi, welcome to today's episode on pressure care in seating. I'm going to specifically talk about recliner chair seating. So in our previous episode, we talked about how the right recliner chair size can affect things like your posture as well as your pressure distribution. Well, today we're going to zero in on pressure care specifically. So we'll look at things like what are aspects that affect pressure care when we're looking at recliner chairs. Things like your materials or your seat covers, your backrest recline, your tilt and space. We'll look at recliner chair seating cushions and how you would choose the right cushion for your client. We'll also talk about a few common myths or mistakes or traps that you can fall in when you are prescribing recliner chairs and looking specifically at pressure care. So let's jump in. So first thing that we want to know about our recliner chair seating with regards to pressure care is what are the factors that we are really looking at. So there's four main factors that I want to address in today's episode, and that is the effects of pressure, shear, friction, and microclimate, and how those things are influenced by the product that we get or the materials that we have. And then also look at some of the common chair functions and how that can help us to get really good pressure distribution, or how it can even be detrimental to our pressure distribution. So when we look at pressure, friction, shear, and microclimate, these are all extrinsic factors that influence our likelihood of getting a pressure injury. We can get what we call intrinsic factors as well, and that is if someone has a condition or high BMI or their age that makes their skin vulnerable or affects their tissue tolerance. Those are things that we don't have a lot of control over. But our extrinsic factors like pressure, shear, friction, microclimate, we do have control over those things. Now, when we look at pressure, we can manage pressure in two ways. So we can either get pressure redistribution, where we want to increase surface area, so increase how much of our skin is in contact with our chair or our seat or armrests, because all of that is going to help us to distribute pressure more equally. Just think of it as the more of the body that's in contact with the chair, the less pressure one specific area will have, especially your bony prominences. If you think of it in a practical way, if you press your finger into your palm, it's a small surface area. If you take a flat palm and push that against each other, two palms against each other, you're using the same amount of force, but because there's a larger surface area in contact, the pressure is spread more. So whenever we're looking at pressure distribution, we want to make sure that we have what we call immersion and envelopment. So immersion is in sinking into our cushion, and then envelopment is the cushion contouring around us. So we want to have both to have that maximum contact. And we want to have the right chair size as well, because then we know that our arms are in contact with the armrest, our feet are on the ground, our thighs are fully on the seat, and that all helps with pressure distribution as well. But we can't just have pressure distribution. That's where we have the other method for pressure management, which is pressure relief. Now, when we have pressure relief, we talk about offloading or weight shifting, or we talk about repositioning. And this is where we're taking pressure completely off of our seated surface or from the skin, and we're getting that reperfusion, so blood flowing to those areas again. So we can't just sit in a chair with a really good cushion, but just stay in it. Even if we do have a very nice immersive and enveloping seat cushion, we still want to be shifting our weight, getting out of the chair. We still want to have that. And in some cases, your client isn't going to be able to reposition as often. And that's where they might look at an offloading cushion, which would be your alternating air. But ideally, you want to still have both. And even if you have an offloading or alternating air cushion, it's still best practice to get the person out of the chair or to get them to shift their weight. We don't want to completely eliminate that repositioning, but it does help if it is someone that can't reposition independently, or if it's someone that is at a very high risk, which we'll cover a little bit later when we talk about seat cushions. So now we know we need pressure redistribution and pressure relief. We now want to look at things like shear and friction. So when we talk about shear, this is where we actually get these opposite parallel forces. So if I'm sitting in my chair and I'm reclining my backrest, what's going to happen is that I'm going to start sliding down the chair. My pelvis, my skeleton moves down with gravity. We all have gravity acting on us. But what's happening with the tissues is they're actually sticking to the chair. So my bum's sticking to the seat cover and my skeleton's moving down. So now they're actually getting stretched in opposite directions, and that's causing damage to the cell structure. And when we get damage to the cell structure, we have contents from that cell leaking out and damaging the cells in the surrounding area, which is why pressure injury can develop very quickly. So shear is a very important thing to also consider. And a lot of times your friction and shear get talked about together because friction can make shear worse. If we have a lot of friction on our seat cover, we are going to have the skin, there's going to be more resistance for movement, which is why we do want to look at our seat covers and what type of material we have. Is it stretchable? Is it breathable? Those are things that are important as well. Because think of friction, for example. If I'm moving on my chair, I want my material to move with me instead of against me. And that's why a lot of times your seat covers need to have that four-way stretch. Another reason we want to have the four-way stretch is for that pressure redistribution, that immersion envelopment, because we want to have the material stretch so we can actually sink into it. If it doesn't stretch, it's like a tight hammock, and then we're actually not making fully contact with our seat cushion. So that's where four-way stretch comes in with shear, friction, and with pressure distribution. Now the fourth one is our microclimate, managing our microclimate. When we talk about microclimate, it's the levels of moisture and temperature around the skin. So if we are sitting on a seat cushion that is really hot, we have a seat cover that's not very breathable, we are going to get a lot of sweating, so a lot of extra moisture around the skin. And we know that excessive moisture on the skin actually makes the skin more vulnerable to breakdown. So let's go into a little bit more detail on just seat covers. Why do we not want someone to be putting on towels and blankets and incontinence pads on top of their seat cushion? Well, what's happening is we're adding a bunch of layers that is taking away from the effectiveness of my pressure care cushion. They're typically not stretchable and not breathable because they're waterproof. And then we're actually taking away from that immersion and envelopment and pressure distribution that we're supposed to be getting from our pressure care cushion. Now let's go a little bit more into detail on different pressure care cushions and what you need to consider with pressure care cushions. So I wouldn't necessarily say there's one specific pressure care cushion that's the best, because it's really going to depend on a case-by-case basis. It's going to depend on quite a few factors. The common pressure care options that we can get in recliner chairs and even in some wheelchairs is our foam, which could be a viscoelastic foam, which is memory foam. We could have some more high specs foams, so foams that have a more of a bounce back, so more responsive, whereas your memory foam does have that really good immersion and envelopment, but it doesn't bounce back very quickly. Foam is one that everyone's usually very familiar with. It's something that is low maintenance, it's stable for transfers, it's something that can be customized because we could have a pommel, we could have an ischial shelf, we could have one side built up if we have someone that has what we call pelvic obliquity. So we have a few things we can do with foam, but foam is typically for prevention. If someone has a pressure injury or they're at a very high risk of developing pressure injuries, we might want to have something a bit more advanced. Or if we have someone that just doesn't really reposition often in the chair, foam might not be enough. So this is where we might look at castellated foam. So castellated foam is where we have this little grid cut on the top few inches of our foam cushion. So what we get is castellations, little blocks, and it's all anecdotal evidence. There's very limited scientific evidence that castellated foam is seen as being more immersive and cooler than your memory foam, for example. So we have then these little grooves in the foam for more breathability. There's airflow between those layers or between those little grooves. And if you can imagine, it's like a keyboard where every key on the keyboard is a castellation. You can really have very good immersion in one specific area. So if there's a bony area, it's going to really be nicely squashed in, if I can put it that way. And then we're getting more of that envelopment or contouring around. Then we have gel, which you can get different types of gel. You can get gel that it has really high maintenance, where the gel actually needs to be kind of repositioned. And then we can get a solid gel, which has like a honeycomb structure. So depending on maintenance, your solid gels are going to be a lot better in that case, but it's going to depend on what your client prefers. In some cases, gel can be seen as having a poor microclimate, where the gel is either going to be cold when you initially sit on it, it takes some body heat to heat up, and might even retain a little bit of heat. Then we have our static air or non-powered air cushions, and this could be where we have little cells, and we can even have some areas inflated more than others, and they can kind of be blocked off, but the pressure in the cells stay the same. We don't have any power going to alternate the cells. So this is something that you could use, but be mindful of it might have quite a bit of a maintenance requirement, because you will have to check if there's a leak or puncture, and that requires training for the caregivers or the family members to check that on a regular basis. And there has been a lot of cases where OTs have heard that the client is finding the seat very hard, they're possibly starting to develop a pressure injury, and when they actually look at the cushion isn't fully inflated and the person's bottoming out, so they're making contact with the base of the seat. Then we have our alternating air seat cushions, and this is where we have also little cells, but now we have a row of cells inflated, the row next to it will be deflated, and the row after that will be inflated again. So what you're essentially getting is 50% of the body is loaded with pressure, and that's supporting the body, and then 50% is offloaded. So we're getting areas, 50% of the body that doesn't have any pressure. So we're getting that offloading, we're getting that pressure relief. And it's about 10 minutes, typically, with your pumps, that it then switches over. And something that we do need to be mindful of, though, with our alternating air cushions, is that typically it is reliant on a power source. Now, this could be that it is plugged into a wall, plugged into a power point, or it could be that we do have a rechargeable battery. So we need to know that it might not have as much of a maintenance requirement, because typically if there's a pump, there's a low pressure alarm. It will tell you if there's a leak or a puncture, but I still need to make sure that it is powered. Why do we not want to have a seat cushion on top of our recliner chair? There's a few reasons that could be a bad choice or a mismatch, because we could have someone actually throwing off the height of the chair. So we talked in the previous episode about how size is very important for transfers, for good posture, for good pressure distribution. So if we're not adding on a seat cushion and that adds a couple of inches to my seat, I might have someone that is sitting with their feet dangling or having excessive pressure on the front of the thighs, behind the back of the knee. We could have those issues. Also, something that I've seen quite often is where clients kind of fall into the seat, and what they end up doing is they push the cushion towards the back, and they're not actually nicely sitting on it, because it's typically a loose cushion. And what ends up happening is they actually cause pressure somewhere, because now the cushion is actually bunched up towards the back of the chair. And then a third scenario, other than height and bunching up the cushion, is where people have that lift and forward tilt rise of recliner chairs, and because the seat cushion isn't fixed to the seat, they do have it's a bit of an instability where the seat cushion actually moves. So there is a bit of a risk of a fall where the seat cushion can actually slip out underneath the person, and it could be that they didn't actually slip out of the chair, or could even be that they go into a poor posture from the cushion slipping out. So the next thing I want to talk about is the chair functions and how our chair functions are going to be beneficial for pressure care. So we have a few that we will look at. We will look at things like tilt and space, backrest recline, and the combination of backrest recline and tilt and space, as well as things like your foot plate in some cases if you do have a foot plate. So when we talk about tilt and space and backrest recline, we need to first differentiate between the two because they're not the same thing. So when we have backrest recline, we open up the backrest angle. So our angle between our backrest and our seat gets bigger. When we talk about tilt and space, the seat and backrest angles stay the same. So imagine it at 90 degrees and the chair fully tilts backwards. So you stay in 90 degrees and it just gets tilted backwards. So backrest recline, tilt and space, different. They can be used together. So you can have someone tilt back and then open up the backrest. When we look at our footrest or foot plate, this could also be something that can be at a 90 degrees, or we can even get what we call a negative angle. So instead of having a 90 degrees, the foot plate is kind of turned downwards. So let's first just go through backrest recline because that's probably the most common function that you'll have in your recliner chairs. So a lot of times when we're sitting in a chair, we get fatigued, we want to rest. When we just open up the backrest by itself, what's ended up happening is we go into this posterior pelvic tilt sacral sitting posture where we're really sitting on our tailbone and we start sliding down the chair. We have excessive pressure on our tailbone, which we already know is a very vulnerable area. So not good for pressure care. When we look at tilt and space, we maintain our posture and we can maintain that kind of 90 degree sitting. So we have really good equal distribution of the different areas. But what we're actually doing with our tilt and space that's very important is we're distributing pressure from a small area over to a larger area. So imagine if you're sitting in a 90 degree chair, you're sitting upright. Gravity's acting on you, you're getting a lot of pressure going through a small surface area, which is your buttocks. If you're tilting the chair back, we're shifting some of that pressure away from the buttocks over onto our back, which is the larger surface area, which we already mentioned in the beginning. Larger surface areas, the pressure is spread a bit more, so we have less concentrated pressure. Now, it is important what that angle is of tilt, and we can still use backrest recline in this case, but if we use backrest recline after we've tilted, we don't get that sliding down the chair, because now we're being kept towards the backrest of the chair with gravity. So from studies, they found that tilt and space needs to be between 30 and 45 degrees to be effective. So we don't want to go past 45 degrees because that can become detrimental again for pressure care. It is very difficult to tolerate, but we do want to have more than 30 to sufficiently redistribute that pressure. So important to look for 30 to 45 degrees, and then having that backrest recline in combination with your tilt and space works really well. Ideally, you want to keep changing your positioning in your chair for pressure relief, because none of us can sit in one position the whole day. We do shift around, we shift our weight around, and that's what we're getting with tilt and space and backrest recline. Now, when we talk about the foot plate, this is typically something you'd have in your mobile chairs, but we'll talk about it with your recliner chairs as well, because it is something that could potentially be a factor. So if we have someone that has that plantar flexed foot or kind of foot drop posture, so especially someone that spends a lot of time in bed, they're not getting that stretch in their feet, or they're not getting weight bearing, we can get plantar flexed feet. Now, if you have a foot plate that's 90 degrees, the front of your foot's going to get a lot of pressure. So having a negative foot plate angle helps that instead of just having pressure at the front of the foot, the whole foot is in contact with the foot plate. And that's also good for pressure distribution. An important aspect with our backrest recline that I also want to cover is that it does matter what the backrest recline design is, or how it works. So we have something called regression or auto regression, and you actually get this in profiling beds as well. So when we sit upright or we recline backwards, we have lengthening and shortening of our muscles. So when we are using a backrest in a chair or using a head raise in our beds, we want the bed or the chair to essentially grow to allow for that lengthening of muscles. So if I just had a backrest that moved on a hinge, which isn't the way our bodies work, we don't move on an exact hinge, we're going to have squashing, we're going to have pushing the person down the chair. So we're going to get shear. When we have what we call regression, you'll see that the backrest, instead of moving on a hinge back and forth, it actually, when it reclines backwards, it kind of moves away from the seat and moves backwards. It almost looks like it wants to almost move underneath the seat, but it moves away from the person. So what we're getting is that it allows for that lengthening of the person's back. So that's what we would call regression. In some cases, it's called body move technology because it moves the same way as the body moves. So let's do a little bit of a recap on today's episode. So we went through what are the different pressure care concepts. So we went through pressure, friction, shear, microclimate, and how it influences things like your cover. We talked about seat cushions, types of pressure care cushions that you can get, why you don't want to put a pressure care cushion on top of your recliner chair, and why you might want to rather have it integrated into the seat, so have it cut out and put into the seat. And then we talked about a few mechanisms in our chair and how that can help reduce pressure. We'd love to hear from you. If you have any stories about clients that have had pressure injuries, high risk pressure injuries, what has been their experience with recliner chair seating? Stay tuned for our next episode on posture in recliner chair seating.